All right. Another bandage is the Declaw bandage. And so a Declaw is a surgical excision of P3 of the digits, usually of the forelimbs of cats. This animal is anesthetized. You can imagine that this is an invasive procedure. Granted, there are many ways for a surgeon to do this procedure, and some of them are more invasive than others. The laser declaw is the least invasive, but nonetheless, even after a laser declaw, a surgeon might want you to place a declaw bandage to control that bleeding and to provide some compression, some cushion to that paw. So when they're sleeping, but you're going to help me with this.
Yep.
We're going to take the paw and we're just going to make a little boxing glove. And we're going to put a telfa pad over it. So again, a little bit of padding, but something to absorb all of that blood and serous drainage from those surgical sites. Then what we're going to do is we're going to take some cling wrap, because cling wrap is nice. You could also use a cast padding because both provide some padding. We want a little bit of compression, so I would like to argue that this might be a little bit more ideal. I want to keep that telfa in place, so again, the first time as I wrap it around, I'm just going to make a boxing glove, and that's in reality what you're doing. You can see here that I'm really not pulling it, so even less compression than that, what you noticed on the Declaw bandage. Some surgeons will have you bandage to the carpus. Some surgeons will have you bandage to the elbow. That's up to them. Different strokes for different folks. Now let's just wrap it up. We need, oh, I don't like that. It's because there's some space down there. I want a cushion for all of it. Oh, yeah. This cat is not going to walk on these paws for 24 hours. This cat is, once it starts recovering from anesthesia, it's going to be uncomfortable. And so therefore, you're going to have some happy drugs, some pain medicine. So hopefully you just, no clubbing tonight, no partying. You're just going to sleep in the kennel, relax in the kennel. And the cat is probably going to be hesitant to walk on these. They can, but it's going to be awkward because it's like walking on boxing gloves. So look at nice cushion all the way around. Now we're going to use that contact layer, the primary layer, that third layer, that superficial layer, to keep it in place. And so again, you've got two options of Elasticon or your vet wrap. And again, 6 of one, half a dozen of another. Some people, if they do choose your vet wrap, I'm going to go with pretty purple. Not that you care, because you're sleeping. But today I'm kind of in a purple mood. Relieve that tension. It's not like this cat is going to be going outside, but again, if we do use our litter box and it gets wet, again, we are going to make sure that we vet wrap or Elasticon all of that primary and secondary layer. If you need more vet wrap, again, you can loosen it. Some people argue that Elasticon is a little bit better for this because of that stickiness, and when you start working with it, it's really sticky. And you are going to, this Elasticon is going to stick right on the fur, so that if it's really sticky, it's less likely to come off, because this cat might do this. So if you're going to use vet wrap to secure this, to prevent it from falling off, maybe you just simply put a layer of tape, so that when you remove this bandage, when the animal is awake, ultimately this sticky substance from the tape isn't as sticky as the elasticon and therefore not as invasive. When we remove this bandage 24 hours later, again, this patient will be awake, and we have to envision where the digits are, because just like the Declaw, we don't want to poke at that incision. That would be uncomfortable. The one advantage is this cat will be helping you. So, well, not like that. But I'll show you what I mean.
Okay.
But that's adorable that you want to help.
Yeah.
How do you think you're going to be helping? You're going to be going like this.
Yeah.
And so I'm going to cut a little bit and then pull it away, and this cat is going to help me. And then again, you can observe for how much blood loss there was, and you can observe quickly, because this cat won't give you a huge window. Granted, keep in mind, yes, I paint a picture of discomfort, but you're still on your pain medicine, and you will be for many days.